It looks like we've gotten probably most people that are going to be joining in. So hello to everyone. My name is Clark Collins. I'm the Deputy Director of Benefits and Wellness, for those of you that don't know me. Welcome to the fourth day of the State of Vermont's Virtual Benefits Fair. Typically we do hold these year over year during the flu shot clinics. But this year, that just wasn't a viable option due to the pandemic. So we decided to switch over to this virtual format, which I think has worked quite well. We've had 3 days so far, and today is the fourth day with Northeast Delta Dental. Personally, I'm going to miss the free toothbrush, but at least hopefully we can at least still pass along some good information. Just a reminder that in addition today, there will be one final virtual benefit presentation tomorrow from our EAP program, again, 12 to 12:45. So today, I'll have this brief sort of introduction, and then I'm going to pass the mic over to Sarah, who's here from Northeast Delta Dental, who will go through the slide presentation. And then we'll finish that up with a question and answer session. So if you have any questions as we're going along, please throw them in the chat. And hopefully we can get to everyone's at the end. Just as a reminder, this is we are recording this and it is not confidential. So any of the questions that you do have, try not to make them regarding a personal situation. Try to keep them at a polite level. I think that's all from me. So with that, I'm going to pass it on over to Sarah, who will lead the presentation, and then I'll come back at the end for the question and answer session. Oh, you're muted, Sarah.
Okay, sorry about that. I was trying to mute everybody, and then I think I accidentally muted you for a moment in the middle of what you were saying, but I'm going to mute all now, and that'll mute everybody except for me. I am also going to go off of the video so that I don't distract myself. And again, welcome to Understanding Your Dental Benefits. I am Sarah Thayer. I am the account manager for the state of Vermont Employee Dental Assistance Plan, and we'll give a brief overview of how dental insurance works and provide you with important information to help you understand your benefits better. So thank you for attending. Just going to do one other thing. I apologize. Wow. So my visual is not cooperating. Just bear with me a moment. I'm gonna try this again. Okay, thank you for hanging in there, and I'm hoping this will work this time. There we go. Okay. So with Northeast Delta Dental, we have a local company that provides you access to a national network. With our plans, you can see any dentist that you like, but you'll get the best value when you see an in-network dentist, and we'll cover the network in further detail later. But other topics we'll cover today includes just an overview of your dental benefits, a review of the Health Through Oral Wellness program, the network options. We'll look at the iMed Vision and Hearing discount program automatically included as part of your plan, and take a look at online tools and mobile resources available to you. So this is a nice overview of your benefit. Dental insurance is broken into different categories: coverage A, B, C, and D. So coverage A is what you think of as your checkup. Those services are covered at 100%. It includes cleanings, evaluations, x-rays, fluoride treatments. Coverage B services, the basic restorative category, those services are covered at 80% after you have satisfied an annual $25 deductible. Just a side note on the deductible, you'll notice that it's $75 per family. So what that means is the first 3 people in the family satisfy $25, and then it is satisfied for the whole family. Back to the coverage B category, these are things like fillings, extractions and oral surgery, root canals, gum disease treatment, emergency treatment. Major restorative services or coverage C category, these are covered at 50%. You see the items listed here like crowns, onlays, bridges, dentures, and implants. All 3 categories, coverage A, B, and C, apply or accrue towards an annual maximum, which is $1,000 per person. And what that maximum refers to is the maximum amount that each covered person can receive in dental benefits in the year. And your contract year runs from July 1st to June 30th. I'm going to just try to mute yourself when you come in. Thank you. Coverage D, or the orthodontic benefit, is a separate lifetime maximum of $1,750. Braces are covered at 50% for children and adults up to that separate lifetime amount. Don't know why this. Oh, here we go. Okay, your plan includes our Health Through Oral Wellness program, or HOW for short. So HOW is based on the concept of patient-centered oral health, and the idea behind it is to help improve and maintain better oral and overall health. So how does HOW work? You just simply ask the dentist or the dental office to do a risk assessment. This assessment is instantly submitted electronically to Northeast Delta Dental. So any patient that scores a 3, 4, or 5 on the 5-point risk scale for being at risk for gum disease or tooth decay can receive additional preventive benefits. So some examples of those additional benefits are up to 4 cleanings a year, fluoride treatments for adults. The chart on the bottom half of this slide here shows you all of the additional preventive benefits that a patient can qualify for. Just one thing I want to point out is that if you do have additional preventive benefits, they do apply towards that annual maximum that we discussed earlier. So let's talk about the network. Your plan includes access to 2 networks, the Delta Dental PPO network plus the Premier network. And this represents the largest dental network in Vermont and across the country. So while you can see any dentist, you're going to get the best value when you see an in-network dentist. It'll bring you greatest convenience and savings. Advantages of seeing a dentist in the network is that there'll be no balance billing. The dental office will submit the claim paperwork for you, and they cannot ask you to pay upfront at the time of service for anything covered under the plan. You'll get the very best value when you see a dentist in the PPO network, as PPO providers have agreed to even lower reimbursements for services, so you'll have lower out-of-pocket expenses, and you'll stretch your maximum dollars furthest when you see a dentist in the PPO network. And if you need to find a new dentist or check to see if your dentist is in the network, there's a Find a Dentist search tool right on our homepage. So I have a claim example here. This just kind of talks us through or shows us the difference between how it works if you go to a different type of network provider. So let's say, for example, you have a major service like a crown, and the crown costs $1,000. As you recall, crown, those major services are covered at 50% under your plan. So with a PPO provider, we're going to allow $800 for that crown. That PPO provider has agreed to accept that reimbursement for service. So $400 is going to apply towards your annual maximum, and your out-of-pocket responsibility will be $400. In the Premier network, this is also an in-network provider. The reimbursement is slightly higher. The service is still covered at 50%. So $450 would be going towards your annual maximum in this example, and your out-of-pocket responsibility would be $450. If you see a dentist that is outside of the network, we do have a reimbursement for each service or procedure for out-of-network dentists, but you are responsible for whatever that out-of-network dentist is charging. So we reimburse 50% of our allowance, and then you, the patient, is responsible for the difference between that allowance and the full charge that out-of-network dentist is charging. The good news is, as I mentioned earlier, the majority of dentists in Vermont are in our one or both of these PPO plus Premier networks. Okay, wanted to make sure you knew about the Vision and Now Hearing discount program that is part of your plan coverage. It's free, it's automatically included for all Northeast Delta Dental subscribers and their dependents. I like to think of it like a coupon. It's not insurance, it's just a discount. You and your dependents can receive savings of up to 35% off eyewear and up to 40% off hearing exams, with additional discounts applied to glasses, contacts, LASIK, and hearing aids. So to access this discount, just go to a participating provider and present this flyer that you see on the right-hand side here like a coupon. And you can download a copy of this flyer from our website, nedelta.com. You see that address at the bottom here, and you can also look up to find participating providers on our website. Northeast Delta Dental provides access to all of your benefit information paper free, whether it be on our website or on our mobile app. The patient benefit lookup portion of nedelta.com is where you would find your claim and benefit information, view and print your explanation of benefits, access your plan documents, or print any replacement ID cards. But there's also a lot of other information on our website as well. So we have an image here of our web homepage. This is where you would find a dentist. We talked about earlier, this patients tab at the top is where you would access that patient benefit lookup portal. And then this HOW logo is where you can link to our healththrough-oralwellness.com website, where you can register for the HOW program to receive our oral health newsletter. You can also take an oral health self-assessment on the site there as well. So right from, let's say you needed to look for a new dentist. After you click on that Find a Dentist button there, you're going to be brought to an online directory to search for a participating dentist. So in the dental network selection, you can select PPO network or you can select Premier network. If you're looking to find a new dentist, I always recommend look for a new dentist in the PPO network first. As mentioned, you're going to get the most out of your benefits there by stretching your annual maximums dollars the furthest and saving on any out-of-pocket costs with a PPO provider. If you're looking to find out what network your dentist is in, you can select Premier and then put in your dentist's name along with the city and state or the zip code, and then it'll indicate if your dentist is in the Premier network, and if that dentist is also in the PPO network, it will note that there as well. You'll see at the bottom here how providers, this provides an indication of if that dentist is using the HOW risk assessment tool. The next image that we see here is just kind of gives you an example of search results. This is where you can see that it indicates that a dentist is in the PPO network and the Premier network and is using that HOW risk assessment tool that we talked about earlier. I mentioned earlier accessing the patient benefit lookup portal. You would click on patients at the top, and then you'll see a purple login button on the bottom left-hand side. And then all of the information on that portal, whether it be your dental plan description booklet or certificate of insurance, your claims information, whether you have qualified for the HOW program, all of that information is also available on the Delta Dental mobile app. You can download it for free from the Apple App Store or from the Google App Store. So thank you for joining us today. I'm happy to take any questions that you may have regarding the dental benefits for the state of Vermont. If you do have any questions that are specific to your claims or your personal information, I encourage you to contact our customer service department. I've provided the toll-free number here. It's also on the back of your ID card. You can also email them or, as I mentioned, view it, your claim information on our website.
All right. Well, thank you very much, Sarah. That was a great rundown of the benefits, and I hope everyone learned something from the presentation. If you have some questions, again, please feel free to throw them over in the chat. I only had one come through. They actually sort of came through privately to me. That I'm actually going to answer for everyone because I think it's actually it's a very good question that I think would benefit everyone from hearing. The plan year is July to June. But that is not necessarily tied into our open enrollment. Our open enrollment is every November. It's for the month of November. But it should be noted that employees automatically get enrolled in dental benefits. This isn't something that you necessarily have to enroll in during open enrollment. You can make a change at that point and add people to your plan. But in terms of actually enrolling in the plan, it's automatic and is 100% employer covered. So during the open enrollment is when you might want to add people, but otherwise, as you cross the, I believe the 60-day mark of being employed, you get the dental benefit. There was another question here that just came in. Is there a way to go onto the website to see how much of your deductible you have used or have left for the year?
Yes. So I really apologize for my technical challenges here because I have not been able to advance the slide as I normally think of. I'm just going to go back here. So when you go to our website, nedelta.com, you're going to search on or go to the Patients tab. So when you go there, you're going to log in here, and this is where I don't have a screen image of it because it would display personal information, but that is where you can see if you have met your deductible, where you are towards your maximum. You can view your explanations of benefits and look at other claim information as well.
Excellent, thank you. And there you go. People are correcting me. I'm the Deputy Director of Benefits, and I got a correction here. Thank you, Michelle. I didn't mean to say 60 days. I did mean to say 6 months. Is after 6 months of employment is when the dental kicks in. I was thinking of something else in my head about the 60 days. So thank you for the correction.
I did get there's another question in the chat here about the additional benefits. The question was, do you mean additional supplemental through the state coverage, or are you referring to the VSEA plan? So in the information that I covered earlier, I was not referring to the VSEA plan. What I was referring to is, I'll just go back here, the Health Through Oral Wellness program, which provides additional preventive benefits to patients that are at risk for oral disease. So you would qualify by having the dental office do a risk assessment, and any patient that scores a 3, 4, or 5 on a 5-point risk scale for being at risk for tooth decay or gum disease can receive these additional enhanced benefits here. I do know that a number of people do enroll in the VSEA supplemental dental program. Because the state plan already covers diagnostic and preventive care services at 100%, the VSEA supplemental plan does not provide any additional coverage for preventive care, although it does supplement the basic, major, and orthodontic benefits.
Great, thank you. Are there any, are custom dental night guards covered?
I know that they are typically not covered under most of our plans. I do not know off of the top of my head if they are covered under the state of Vermont plan. You can always call customer service to double check, but I will say they are typically not covered. Another thing that is available and kind of a frequently asked question is, how do you find out ahead of time if something is covered under the plan, or if it is covered, how much it's going to cost? So that is something you can find out by asking your dental office to do a predetermination. You just ask the dental office to submit that to us. We process it kind of like a claim. So the dental office gives us a treatment plan. We get back to you, the patient, and to the dental office to let you know what portion of that service is covered under the plan and what portion the patient would be responsible for.
Okay, thank you. Another question just came through regarding the VSEA supplemental plan. Does it link to the regular plan when bills are submitted? Meaning, is it supplemental to the state coverage?
So if you are an employee that has the state dental plan and you've enrolled in the VSEA supplemental dental plan, it is linked in the way that the two plans work together, but it is not linked to one subscriber ID number. So you have to give the dental office your two different subscriber ID numbers. We do not issue new ID cards every year. So I know there are a lot of employees at the state of Vermont that have been there a long time and been enrolled a long time. So if you've lost track of your ID card, all you if your dental office probably has it on file, but if you want to make sure that you have both ID numbers, you can always call our customer service department. I'll bring that back up here on the visual to get both of your ID numbers. And then you can print off a paper ID card, or you can pull it up electronically on the Delta Dental mobile app after you've registered.
All right, great. I don't know if this was covered on the slide itself, but on the slide that mentioned that the vision and the hearing aid benefits, where do you find that information?
So right on our website, nedelta.com, in the patients section, there is an area for the iMed discount. So that is where you can download a copy of this flyer to use like a coupon, and that is where you can look to find participating providers.
Okay, great. I did just have someone ask if they can ask a question verbally, and yes, if you have a question verbally and you're not able to submit something through chat, then please unmute yourself to ask the question.
Okay, thank you. It's just that it's a little bit elongated, so it would be a little complicated to type it out.
No problem.
The dentist practice that I am associated to has 4 dentists listed in your site. 2 of the dentists are listed as Delta Dental PPO and Delta Dental Premier. 2 of the dentists are listed as just Premier. Is there a reason for this? Isn't the practice itself identified as either or both?
No, we do contract with individual dentists. So that is why you will see the difference there. The PPO network really is more consumer friendly. As I mentioned earlier, you're going to save the most on your out-of-pocket expenses and get the most out of your benefits when you see a PPO provider. So new dentists that want to join our network, we do require them to join both networks. More established or dentist probably originally joined our Premier network and does not want to join the PPO network because they don't want to further limit the reimbursement. So that would be the rationale behind why there might be 2 in network and 2 out of network. But we do contract with dentists individually, not per office.
Okay, so if I go into my dental office, depending on who I see, there could be different charges depending on who I'm seeing.
Correct. Yeah,
Okay.
and there's a good example there that a coworker likes to share a lot of times. Her dental office had two dentists. One is in the Premier Network. That's the dentist that she always used to see. And then she looked it up and found that the other dentist is in the PPO network. Well, she can still have the same hygienist that she loves, whether, doesn't matter which dentist that she sees. So she just requested to see the PPO dentist.
Thank you.
You're welcome.
Okay, any other questions? Again, submit them either through the chat or you can unmute yourself if you're on the phone. Okay, I'm not seeing anything else come through.
Well, I
So
do
let's,
have one more question in
oh, there you
regards
go.
to the benefits of vision and hearing. So the
Sure.
requirements for IMED is vision checks for prescription contact lenses annually, but our plan only covers every other year. Is there a reason for that?
For the every other year?
Yeah.
It's basically it's part of the overall bargain benefits as they stand now. Not to say that it's not something that could change or something that would be considered to be changed, but that would be part of the bargained benefit package.
Is there somebody that we should be soliciting to for, I don't know, annual coverage instead of every other year? Because, like I said, the IMED network requires for prescription contact lenses that you have an annual exam yearly. So,
Sure. Without getting into too much detail, are you currently covered under one of the unions?
yeah.
Then I would solicit your union to bring this up or to bring this up at the next bargaining session. Otherwise, you can also come to me as the benefits director and make your solicitation that way. Again, this isn't necessarily something we haven't heard or haven't considered, but so far it has not been something that's been changed during the bargaining process.
Okay, thank you.
Sure. Any other questions? All right. Well, then I would like to thank everyone for coming to attend. I feel like this was very informative. And for those that might have missed my message in the chat, all of the sessions that we have this week, including this one, have been recorded. So next week, hopefully as soon as possible, I will be putting something on the website, on the Virtual Benefits Fair website, that will have a recording of each of these presentations as well as any supplemental information that comes in after. So thank you for everyone for attending. Thank you very much, Sarah, for your time and for giving the presentation. And I hope everyone has a great day.
Thank you very much.